Well, welcome to Mama Juice. So do you
Yeah,
want to just introduce yourself and maybe talk a little bit about what we're going to be talking about today?
sure. Hi, my name's Effie Parks. I live in Seattle, Washington. I'm the host of a podcast called Once Upon a Gene. It's also become a talk show on the Disorder Channel with a couple of my co-hosts. And yeah, I had a son 4.5 years ago who was born with a rare disease. And, it was a thrust into a world that I had no clue about, and I had no resources, and I had no people like me. And there were barely any podcasts on the subject as well. And, it just got harder and harder the bigger the gaps were between my kid and other kids. And just my day to day in general was so different than everyone else's that I knew I had to find my people. And I started my podcast for that reason. I spent hours in the car every day taking my son to doctor's appointments 5 days a week, and podcasts became a lifeline for me. And there were only a handful talking about my world, and I knew I needed to contribute to that conversation and find my people.
Wow, that's actually very admirable. Like you could have just been like, poor me, and feel sorry for yourself, but instead you're like, I need something to empower me. And not only did you find that in other people, but then you created it for other people. So that's super cool.
Thank you. I definitely had lots of moments where I felt sorry for myself, and I think that's okay.
Absolutely. Yeah.
It was a really rough time, and it's still rough a lot of the time, but I definitely uh I like a positive mindset more, and I do like to find silver linings and to look forward. And I want to enjoy my life, and my kids are beautiful and my life is beautiful. And yeah, definitely making that choice is something that we all have to do if we want to push forward.
Right, exactly. Very cool. And so what is the rare disease that your son has?
It's called CTNNB1 syndrome. It's actually so rare that they still name it by the gene itself. He is one in about 200 now. It's growing every day. He was one in 30 in the world when he was diagnosed a few years ago. So we're finding more patients with the prevalence and more affordability in genetic testing. So it's been really great to, not so great, obviously, that more people have to join the club you don't want to be in, but great that these families have a place to go to, and we're finding each other and we're learning a lot from each other.
Okay. And so what is that something you found out about at his like when he was born, or did it come later?
We found out that we knew something was wrong almost immediately, just in the sense that we couldn't get him to eat. We couldn't get him to latch, and he didn't have a suck on a bottle. It would take hours to feed him just a couple ounces, and most of it would drip out of his mouth. We had an appointment every week telling our pediatrician that something was wrong. He was crying all the time. He looked like he was writhing in pain. And she kept brushing us off and telling us that we were new parents and that he just had colic. And finally, at the 4-month appointment, going every week again, she looked at us, and I assume, was looking at the growth chart, which we never did speak about before. And she looked at me horrified and told me that Ford needed to go to the hospital because she was worried about him. So at 4 months, we finally got her to listen to us and agree that something wasn't right. And he was admitted into our children's hospital with failure to thrive right then. So that was kind of the beginning of it all.
Wow, that's awful that took that long for you to say something wrong and for your doctor to actually acknowledge it. Did you end up switching pediatricians?
I did. That was the first time I realized that I actually had that kind of power, and that I didn't just need to be a nice, polite girl doing what I was told in a doctor's office. I do have sympathy for her. She actually did come visit my son and I in the hospital that week and apologized. And I know she felt bad for it, but I knew that I needed a different doctor and that she wasn't our person. But I do respect how she finished that off, and that she noticed that she probably made a mistake in not listening to us. But yeah, that was kind of my first nudge into like, you have to advocate. Do you know what that is? Because guess what? You got to become a pro at it real quick.
Right. And, I was not a very assertive person before becoming a mom, and it took years into motherhood. I mean, I'm only a little over 5 years in, but it took a while for me to be like, I have to speak up for my kids because nobody else is going to, and they cannot. So I know what that's like, where you feel like, oh, I kind of want to challenge this, but I'm not really sure. So I get that.
Yeah.
Um, and so then, as far as the feeding issues, did he end up needing like a feeding tube?
Yes. So that week in the hospital at 4 months old, they did try for a couple days to feed him to see if what was happening was actually happening. And ultimately, they were like, Ford needs a feeding tube. So they initially put in something called an NG tube, which is the tube you've probably seen in pictures that goes up their nose and down into their belly. And he had that tube for about 3 months. And it was some of the most traumatizing stuff in the beginning for sure, but also just such a relief because he started to gain weight. He got some sleep. He had a bowel movement. I mean, it saved his life literally,
Yeah.
and he had that for about 3 or 4 months until they actually placed a G tube in his belly. So he had a surgical procedure, and now he just has a little button in his tummy, and he's still fed that way.
Oh, wow. Okay. And so he was your first child, right?
Yeah. Yeah. We have two kids
Wow.
now. I have a two-year-old little girl.
Very cool. Yeah. So I can't even imagine, if you have a child prior, you're kind of in the mode of like how everything works, and you're gaining your strength to be more of an advocate, but your very first baby, and then to be written off like, oh, it's just because you're a new parent. I think one of the best attributes that I see in my pediatrician, who I love, is nothing is ever like, oh, you're just and I'm a paranoid. She knows me personally. I used to work with her. And so she knows that I'm a dramatic, like borderline hypochondriac. Still, no matter what I bring to her, she's like, let's look at it, let's explore it. And I just love that. So that's definitely something to, for the audience to think about when looking for a provider for their children.
Yes, I love that she listens to you openly, and it's so important, right? And we can find those people. Like, if you don't
Mhm.
feel like you're jiving with anyone in your medical team, it's okay to get someone else because sometimes people just aren't the right fit, and there's nothing wrong with that.
Yeah, and I spoke to, was it her? I've interviewed two of my pediatricians on here. It might have been the other one. Um, I've worked with both of them. I work in healthcare, and so I've interviewed two of my pediatricians now, and one of them, we had that discussion because I was so fearful to hurt feelings of people who I knew personally, because, like I said, I worked with a lot of them. And so when I first picked a pediatrician, I went with the one who I jived with the best on a personal level when I worked there. Well, it turned out that she just didn't fit my needs as a provider. And I was telling the other medical staff, like the medical assistants, like, I really want to switch to this doctor, but I don't want to hurt her feelings. And they're like, this is no, like they understand everybody, you have to have the personality fit for you and for your child. And they get that. They want that for you.
Yeah.
And so I did it, and there were no hurt feelings. So
Good. I'm so
yeah.
glad. Yeah, it's scary. It's scary when you're in that position, especially when there are people in power in those positions.
Mhm.
You definitely want to be strategic and you want to be respectful because ultimately it's about the child. It's not about personalities. It's not about anything else. It's about taking care of this little person.
Yeah. And what's funny is I can be kind of like a monotone, like serious person. And so I think the doctors that were like too peppy freaked my kids out, because I'm at home talking to them like, hey, how's it going? And then they go to the doctor and they're like, hi. And my kids are like, what are you? you know? So I think
That's
too,
so
like
funny. I love that.
once once your kids get older too, you kind of got to see like who they're comfortable with, because those like really
Totally.
animated, I'm talking to a kid, people like freak my kids out.
That's amazing.
Yeah. So
I love that.
um are you still doing like a ton of doctor's appointments and stuff, or is he pretty stable?
Well, COVID has been both a blessing and a curse, not just obviously for the world, but for kids like Ford. He has lost a lot of his services. So, in person, especially for a really long time, he does PT, OT, speech, hippotherapy, all those things, school that are so important for him to progress. A lot of those have stopped, and that's unfortunate, and that's hurt his progression a lot. But what has happened is that he hasn't been sick since this started. And normally we're dealing with a fever, pneumonia, RSV, some type of infection somewhere. He's always been sick. He has really low tone, so he can't really get liquid out that well. And it was constant. And this has been the year of health for him. So it's been really cool in that way that he's been the healthiest he's ever been. But yeah, we've definitely been limited on our appointments, especially since only one parent can go and siblings can't join. That's really affected me being able to even get to everything that he does have that he needs, because I got to get a babysitter. I got to, it makes it really difficult to even just navigate how to get somewhere and have someone watch your child and all that. So there's definitely been so many frustrating things like that and barriers like that, but we're just kind of hanging on that this is the healthiest he's ever been. And we're hoping that it's helped repair a lot of his lung damage that he had and just kind of set him on a course to be a little bit stronger when things do open up more.
That makes sense though. Because everybody's staying home, like you said. And I know how hard it is too for parents to have to find like an alternative place for their kids, and I almost feel like maybe there should be exceptions for, just exceptions because people's situations are different. And I know we're all trying to be safe and take precautions, but sometimes allowing that second parent is necessary. And something that always confused me about that is like, you all live in the same home. You all have the same germs. Like, what are the chances that dad's going to bring something in that you're not? So that kind of always like confused me. Like my kids' daycare, they don't let us in the building. And I'm like, I have their germs. They have mine, I promise.
Yeah. Yeah, I know. It's all just, every single thing is just like, okay, put it on my tab. Yep.
Right.
It makes it really difficult, especially for people who don't have any family nearby to help in those moments. And maybe the families who need their interpreter is their spouse, and just all those extra layers that can happen by not being able to bring your partner or even just your kid to the appointment. It's been really challenging for so many people.
Yes, it has. It really has. It's unfortunate, but I see a light at the end of the tunnel. So hopefully, yeah. And so because, and I don't know your stance on vaccines, but because you do have a child who's so vulnerable, does that put you in, as somebody who qualifies for the vaccine?
I think my state is finally putting parents like us on the list. That's just happening like recently within the last week or so. So originally it was the elderly and the workers, right? Like the mandatory workers in our community. So I think parents are now on that next list. So we're all just waiting for that.
Good. Okay. And so your daughter, she's 2. So obviously this is just her normal. She doesn't know yet that brother has this condition, but I'm wondering if you find it hard to meet her needs, because having a son with a rare disease, I'm sure, is very demanding in so many ways. So do you ever feel like you struggle to meet both of their needs in that way?
Absolutely. And that is something that I'm so mindful of. And it's something that's going to be affecting us forever, right? It's not just now that she's 2, it's going to be when she's 12 and when she's 22. This is always going to be the case because she's his only sibling too, right? And we are all going to kind of have to find balance and do this dance to make sure that everyone feels valued and that they've gotten all of our time and our attention and our care. Something that's been particularly just practically difficult during this time is now she's walking and running and doing all of those things, and my son can't. And what I enjoy so much, and so does my son, and just regular life, is getting out for a walk, especially right now when there's nothing else to do. Getting out for a walk is so important for our mental health. But now she doesn't want to sit in the stroller and go on a walk. She wants to get out and play and run around. And my son really likes being in the stroller and walking. And I've had a really hard time trying to figure out how to really make this part work. Like there is one park kind of near me that we'll walk to, and I'll let her get out and play in the playground, and I just walk around in circles on the sidewalk around the play equipment, because then he's happy because he's moving and then she's playing. So I miss out a little on getting to interact with her on the playground, but it's like all I can do right now to like best sort of meet everyone's needs. And I imagine that it's always just going to kind of show up in complicated situations of how we're going to have to figure this out.
Right.
Yes.
And in ways that like not everybody would think, like something like a walk, you're like, you never would have thought that would have been one of your complications. Have you tried a wagon?
I haven't tried a wagon, but my son also can't sit. So he would have to lay down in the wagon if I did that. Also, I don't think that pulling a wagon is like probably the best for my own posture and getting around. I got to take care of my back because I have to lift this kid everywhere he goes. He's not even crawling or anything. Yeah. So I've thought about using a wagon, but then it's like, well, he just has to lay there and he doesn't get to see where we're going on our walk. And then where's she going to fit in exactly? And it seems like it would put strain on my own body. So that's all I've gone towards in that direction for that.
I'm going to have to send you a link. There is this wagon. I don't know if you've heard of it. It's called a Wonderfold. And I use it for my kids. And a lot of mothers with children who are disabled have taken it and transformed it into this like magical ride for them. And so the best way to explain it is it's like a combination of a pack and play, a wagon, and a stroller, because you push it, you don't pull it.
Oh.
And yeah, and so like a lot of people will put like babies at the bottom, and then it has seats where your daughter's legs would dangle, and it's mesh, so he'd be able to see.
Yeah, send me that link. I'd love to check that out.
Yeah, I hope. Oh my gosh, I would be so happy.
That would be awesome.
If that,
me too.
You. Yeah,
yeah, because cool. This is a big one for me, and it's a struggle, and sometimes it just definitely pushes on those emotional aspects of it all. Because getting out for us, especially in Seattle in our weather, it's so important for us to get out of our house. It's dark here. It's we can't go anywhere anyways. So getting out for fresh air is really important.
And these wagons have like crazy accessories you can add. And like one of them, it's like an all weather edition. And so like you just put it over and you can like unzip it and you can see out. And it's for rain. It's for everything. It keeps them warm in there. Like this, I wish I would have discovered this when my children were smaller, because I feel like I lost out of like time that I could use it. But it's amazing. I can't talk about it enough. So I'll definitely send that to you.
That sounds awesome.
Yeah. And so so I didn't realize that your son, he can't sit up. What other complications does it cause for him?
Yeah. So he can't sit, crawl, or walk yet. He does use a wheelchair. So when he's in his wheelchair, he's a wild man. He can get around so well in that thing. Obviously he's 4 though. So that's another thing. I can't just go on a walk with him in his wheelchair and her because we're by the road, right? So he gets around in his wheelchair most of the time. Other things he has low tone in his chest, so he's really floppy. And then in his arms and legs, he has something called dystonia. So that's the opposite in a sense. So they're really stiff and they're really flaily. Those muscles are like constantly firing. So he has a mix of tones. So he's pretty hard to just kind of carry around in general. The feeding tube, he's nonverbal. He has a couple words though. He says dada and hi right now. So we're pretty excited about that. He's he's really expressive. He's he's just really fun to talk to. He understands everything that we're saying, which is really exciting. He knows some sign language and he's really good at nodding and pointing to what he wants. Um, one of the other symptoms is microcephaly. So his head is smaller than the average kiddos, which is what, contributes to a lot of the cognitive delay and stuff like that. And then it makes his teeth a little smaller and things like that. Those are kind of the big things that are showing up for Ford. I would say the dystonia in his limbs is probably some of the hardest stuff to manage. We get Botox in his legs now for him every couple months, which helps relax them. But before we started getting that, like I almost couldn't get him in a car seat. Like I couldn't open his legs to just buckle it. Like that's how much they cross and they're just so hard to move. So it's just kind of that kind of stuff. And the bigger he gets, definitely the more difficult all the physical stuff has become.
Yeah. And so then are there any, I know he's in a lot of therapies. Is there any chance that he'll progress as far as like speech and mobility?
This whole thing, every genetic disorder is a spectrum. So some of the kids who have CTNNB1 can talk and a lot of them can walk. Not perfectly like how you would think, but they're getting places, for most of the day on their own or with walkers. Ford's definitely impacted more physically than a lot of the kids are. So that's unfortunate. But we never say never, and we don't put a ceiling on his abilities. And we are doing everything we can to get him stronger. And he's already progressed so much, even just from last year, in what he can do to like stay up in a sitting position longer. He does something called hippotherapy where he rides a horse, and that has been the most incredible therapy that we've done. And it's helped strengthen his core more than any of the other ones combined. And it's given him a lot of confidence too. And we're really hopeful with that type of therapy that it's just only going to make him stronger and eventually get to crawling and get to taking some steps. So we fully plan on giving him every opportunity he can to reach those goals. But if not, we're just going to make him as healthy and as happy as we can how he is right now.
But it sounds like you guys are just doing an awesome job being there for him and making sure he gets the most out of life. And I really admire that. And I just think animals are amazing. And
yes,
they just play such a big part in kids' lives, especially kids who have disorders or disabilities. It seems like they're a necessity.
I totally agree with you, especially this horse. There's just something magical about it and what it's done for him. Even just like anxiety levels, like you can see what has happened, what kind of transformation has happened in his own levels of that by being around this horse. There's more to the therapy than just the physical stuff for sure.
Yeah, absolutely. And so what have you done other than the podcast and the show to help yourself emotionally and mentally through, having your child and getting the diagnosis and just finding out that something big that you're going to have to deal with for essentially the rest of your life?
So many things. So many things. I think in the beginning, what was really important that I had to learn was to set boundaries. I had to set some pretty tough boundaries in the beginning. Like I couldn't go to my friends' kids' birthdays. I couldn't do things like that. They didn't fill me up, they drained me. And while I love my friends and their kids and I'm so happy for them, it just wasn't something that helped move me forward, especially then when I was kind of in the trenches. So, boundaries was a huge one for me, and it's not something I really ever did before. I'm pretty easygoing. I'm fun and happy and light, and I had to really buckle down and take care of me, um, because I was a yes girl, and I meant it. I meant it, but it was taking so much of my bandwidth when all of that difficult stuff was happening and the world seemed to be moving on without me. Um, and I came to a point where I had maybe been just pushing stuff down and trying to live like everybody else still and trying to be happy and trying to be like strong, that I eventually got to this point where I felt like I was choking. I felt like something was tied around my neck and I couldn't take a deep breath. And I felt like that for almost a year. And I realized that I was going through all of this and I wasn't dealing with it. And it had started to show up in my body. It was my body going, you can't live like this. This is not good. You're not gonna help yourself or anyone if you continue this way. So yeah, boundaries, and then figuring out what I needed to do to take care of myself. First, I got some body work and some stuff like that and all of the things, but I really just kind of let myself feel all of these emotions, and I didn't feel bad about it. I let myself feel the grief. I finally named it. I felt grief. I felt grief for this child that I thought I was going to have that never showed up. I felt grief that I didn't get to experience motherhood like everybody else did. I felt cheated. I just let myself feel all of that gunky stuff, and I didn't feel bad about it. And I just recognized it for what it was, and I let it just move through me, and that was liberating. Like letting myself be okay with how I felt and just really accepting it was huge for me. And it really empowered me to get unstuck. It really empowered me to talk about it and to delegate things that I was trying to do for myself and to accept the help that maybe I didn't want to burden anyone with. And I got it. It really made me laser focused on what was going to help me and my family not only move through this, but grow from this. And, it was a kind of a lot of aha moments, but especially when I realized that I couldn't breathe, I knew I had to make a change because my son is awesome and I love him and I want to love him for exactly who he is. And I just had to really go through the tough stuff consciously to be able to get to the place where I am just so proud of who he is. And I love what he adds to this world and what he adds to any person that comes into the room and shares that space with him. Because who's to say that he isn't just the brightest light, right? And just because I was afraid of this world and we're all afraid of this world, and I happen to join a club that nobody ever wants to be in, it doesn't mean that there isn't beauty here. And I had to just forge that path for myself, because otherwise I think it's easy to get stuck and it's easy to stay upset. And you just really have to shift your mindset. You have to make a choice. You have to.
Right. And I mean, I feel like I think people feel like they know what they would do in situations like this, but you don't ever know until it happens to you. And I mean, I'm done having kids, but if I weren't and my child ended up with some kind of a disorder, I would really hope that I could take a mindset like yours, because it really is a beautiful thing. And I love the way that you light up when you talk about your son. And that is just so cute. And
Thanks.
so is it genetic? Or what?
It isn't anything that we pass down to forward. No, it is just a random mutation that happened.
Okay. So then with your second pregnancy, were you a little worried at all that, something might happen? Like, did that put any fear into you?
I wasn't worried that she would have CTNNB1. I mean, they said it was basically impossible, but we know nothing is impossible. but I was fine. I was like aware that nothing was perfect and that stuff does happen to you, even though you never think it is. So I wasn't naive anymore, where I think as when I was pregnant with my first child and prior to that, every day of my life, I was completely ignorant to the fact that I wouldn't have a perfect child. A typical, what people think is a perfect child. And with my second one, I knew there was a chance of anything.
Yeah, that's so interesting. I spoke to a gentleman earlier for my show who experienced stillbirth with his wife, and we talked about that, because I shared with him that my dad passed away when my mom was pregnant with me, and so throughout my life I was very aware that my mom could die at any time. And he talked about they ended up having two more children after this child, and so a total of three because they had one before her. And he talked about how, like, through those next two pregnancies, the same thing. He was just so aware that something could go wrong. And so it kind of shapes how you experience things, because you're like, no, that can happen. Whereas, like you said, before you experience something like that, it's not in your mind. You're just like smooth sailing, carefree, and then something happens. And it's not just about like pregnancy. It's like now you just know in life that could happen and it could happen to me. So it kind of brings that perspective.
100%. And I liked how you said that it really shifts it, because it does. And it puts everything in perspective, and it really forces you to make the decision to kind of live in the moment more and not sweat the small stuff, right?
Right. Absolutely. Well, thank you so much. I really enjoyed this. Is there any advice you would give to people who maybe are just going through the process of getting a diagnosis of some sort, or they just found out that they have a diagnosis for one of their children?
I would say the most important thing that you can do is to find your people. They are out there. They are me. There are so many of us, and they're just the most incredible people. And all they care about is putting their arms around every other person that has to enter this walk of life. And we're here to help in any way we can. And there's so much support that you don't know about, and that for some reason doesn't just show up on Google. So find your people. I found it through podcasting. Um, you can start with your Facebook groups and move on from there, but you have to find people who are living the same lifestyle as you. You're going to feel alone and you're going to feel separate. And you have to connect to people who know what your day-to-day is really like, the kind of people you don't have to explain anything to, the kind of people that know what acronyms you're using, and all of the things. Even if you don't talk to them and you've never met them in person, they can become some of your closest confidants, and they're there for you. And it feels like everything is possible and everything changes when you can find others like you and make you feel less alone. So that is what I would tell anyone who's struggling or who's just been thrust into this world, is to reach out.
Yeah, absolutely. And I'll definitely link your podcast information so that people can find you a little bit easier. But I really
Thank
enjoyed
you.
hearing from you and hearing about your son and your daughter, and you're an incredible mom, and I really look up to you.
Thanks. So are you. I appreciate you. And thanks for inviting me on the podcast. And thanks for having this podcast and having so many important conversations. So thanks so much.
Of course. You have a good rest of your day.
You too.
Bye.